Welcome to a conversation with world-famous Beverly Hills plastic surgeon and rhinoplasty specialist, Dr. Richard W. Fleming. Today, Dr. Fleming is going to discuss facial sculpting with lipotransplantation. So, Dr. Fleming, what is lipotransplantation?
Well, many people, in fact, I would say almost all people, have some depressions or grooves in their face that are undesirable. Many times this is an unwanted inherited characteristic, but many times it's due to the aging process. So we want to augment these grooves, improve the contours that are undesirable. There's many choices. Today we're going to talk about the use of fat sculpting. Use the patient's own tissue, where we take the fat from one part of their body and put it in another area to improve contour and form. We can get fat from many different places on the body, the abdomen, the legs. That's the source of our fat. One distinct advantage about fat is that nobody's allergic to the fat grafts. It's their own tissue. We see people that inherit or due to the aging process have a deep groove at the lower margin of their lower eyelid. We can fill it there. People who don't have great high cheekbones, which is in most of us a very desirable characteristic, we can contour that with fat. Another very common area that we use it is in the crease, the fold between the nose and the corner of the mouth. We're all aware of lip augmentation. Fat is a wonderful choice for that. What we're doing there is trying to increase the pout, the fullness of the lips in people who did not inherit that characteristic. Or it can also be used to augment the thinning lip, which has become thin, wrinkled because of the aging process. Our interest in lips was really stimulated in 1988 with Barbara Hershey in Beaches. That was the first time people really understood that there was a relatively easy way to augment the lip and improve lip pout and thickness. So since that time we have used it frequently. Another area where we use the fat is on the back of the hands in older people, where the wrinkles are very apparent. The skin is wrinkled, it thins, and it's a real contrast. Fat will last longer because it's the patient's own tissue. The consistency, the naturalness of the result is like your normal tissue. It is your normal tissue. So it is a very positive response from the patients because it does, in terms of appearance and feel, mask their normal tissue. Experience is always very important when we're augmenting any area or changing, improving a contour. However, harvesting of the fat, injecting of the fat is a little more difficult, but any skilled physician who's doing these augmentation procedures certainly could do either.